Hello, my name is Stephanie, and today I will be discussing ways to make evidence-based decisions. I will be addressing a healthcare plan to improve the patient safety of a patient that is chronically sick. Communication and interdisciplinary collaboration are needed for best results. The patient I would like to discuss today is a child that is 2 years old and recently admitted to Valley Medicine Hospital. This is her second admission within 6 months. She came to the hospital for trouble breathing and shortness of breath. Her respirations are increased at 32 and shallow. She's underweight and she's producing thick secretions. Her mother often says that she tastes like salt when she kisses her. After test and evaluation from the doctors and specialists, it is found that Caitlin has a chronic disease of cystic fibrosis. Cystic fibrosis is a chronic catabolic disease, often requiring hospitalization for acute episodes of worsening pulmonary exacerbations, according to Medline. Cystic fibrosis affects the lungs of the patients, and patients suffering from this chronic disease can also have acute health concerns as well, such as pneumonia or bowel obstructions. Being that Caitlin is 2 years old and has such a chronic health disease, healthcare collaboration is vital. Caitlin's parents are currently separated and living an hour away from the hospital of Valley Medicine. Her pediatrician is located closer, but is very busy because it's a small town and he's the only one within a small radius of the town. The pediatrician was contacted regarding Caitlin's condition when she was admitted to the hospital. However, being that cystic fibrosis is very complex, he is not familiar with all of the current treatment plans, which is why telemedicine is shown to be used between providers for suggested treatment plans. Caitlin's pediatrician currently does not have telemedicine, but he has suggested that he would Skype with other healthcare providers to ensure that Caitlin gets the best treatment that she needs. According to Shaw, in an article from 2021 in reference to evidence-based practice for telemedicine, conferences are being used more, especially in pediatric patients with chronic healthcare concerns. While today we are currently battling through a pandemic, COVID-19, it is decreasing exposures for patients with chronic conditions using telemedicine. Patients having chronic healthcare conditions hold a high risk for getting sick because their immune system is already compromised. Telemedicine can be used to have face-to-face meetings with providers with specialties and also with the patients and parents, so to ensure that patients do not miss appointments that are needed. Using interdisciplinary care for chronic health diseases are so important, especially in Caitlin's case. She has a social worker, a pediatrician, a specialist for cystic fibrosis, and a respiratory therapist, and a pulmonologist. To help the parents treat Caitlin appropriately, it's important that they are educated about Caitlin's condition, educated about the medicine, her appointments, and what other therapy she may need. It is also important that they are educated with the signs and symptoms for them to be aware if she comes into an acute exacerbation and needs to either go to the hospital, the doctor, or if they can manage her at home. By using telemedicine, it will be easy for her parents to contact online providers to help ensure that Caitlin gets the appropriate care that she needs. Johns Hopkins Nursing Evidence-Based Practice Model was used for clinical decision-making, developing this care plan. The Johns Hopkins Nursing Evidence-Based Practice Model is a team approach. So by using the respiratory therapist, the social worker, the pediatrician, the pulmonologist, and any other healthcare specialist in Caitlin's care to develop a care that is specific to Caitlin's needs. This will be constantly reevaluating to meet the needs of Caitlin and to progress in her treatment plans. The evidence most relevant to making the medical decisions regarding care for Caitlin was the fact that her parents live far away from the hospital and Caitlin has a chronic disease and she will need constant access to care. By using the telemedicine between all healthcare providers, respiratory therapists, social worker, the nurses at the hospital, the pediatrician, the specialist at the hospital, this will ensure that Caitlin gets the care that she needs. By using telemedicine, this will result in a non-delay in care as well because her parents live over an hour away. They are separated and both working full-time, which is going to be hard for them to make all of the checkup appointments that Caitlin may need. And then there's also appointments that may be spontaneous depending on Caitlin's needs at that time. So with telemedicine being an option, the parents can contact respiratory therapy, or they can contact the healthcare specialist or anyone else in Caitlin's care to make sure that they are doing what's right to make sure that Caitlin is safe and that she's getting the care that she needs so she doesn't get worse and that she can get better. The benefits of having this remote collaboration between healthcare providers for Caitlin was very valuable to her well-being. While the mom was taught to do chest physiotherapy, which is very important with our patients with cystic fibrosis, she was able to communicate with the respiratory therapist via telemedicine to make sure that she was doing it correctly, and they gave her some suggested techniques to make that it work better for Caitlin. Being that she's so little, it's a little scary when you have to do that to your child. Also, it was important that the pediatrician could be contacted via telemedicine as well to know that if Caitlin really needs to come into the office, or if she needs to go right to the emergency room, or however Caitlin can get the appropriate care that she needs. By having these video conferences with the parents and the healthcare providers, it is easier for Caitlin to get what she needs rather than going to the hospital when she doesn't need to and being exposed to other things that she doesn't need to because she's already immunocompromised. Also, there's home health care that can be designed to come in and help Caitlin as well if she may need it when she has her exacerbations. So that is also something very important that could be treated over telemedicine by calling the doctor, asking questions, or if any other concerns come up, the parents can contact the doctors or respiratory therapists or whoever for Caitlin to get the care that she needs using telemedicine, rather than bringing her out whether it's cold or, as I said before, we're in the pandemic, exposing her to unnecessary things that she may not need to come in contact with for her to get sicker. So in conclusion, by using the evidence-based practice model, it helps achieve the goals of the safety and the well-being of Caitlin, keeping up to date with treatment plans while using interdisciplinary care with remote collaboration with the healthcare team, resulting in the best patient outcome for Caitlin. Thank you.